Hey guys, Dr. A here. If you viewed any of my previous videos on gait analysis, I talk about the basic kinematic and kinetic aspects of normal walking, normal healthy walking. And what I focused on is normal mature walking. This is the gait that a child develops after, say, the first 7 years of walking. In fact, the greatest changes that we see in kinematics and kinetics during walking occur in the first 4 years of walking. It's one of the most fascinating phenomena that we see in biomechanics of walking or gait analysis. And there are physicians and physical therapists and biomechanists who have spent years studying different age groups and their differences in the way they walk. So this video, it's certainly not going to do that area of research any justice, but it'll introduce you to some of the determinants by which we assess normal walking in these different age groups. Why is that important? Because if you end up working with children, if you work in a gait analysis lab, or you're a physical therapist who work in pediatrics, you need to recognize what is considered normal walking for a specific age group, especially if you're dealing with a patient who has a neuromuscular disorder such as cerebral palsy, spina bifida, myelomeningocele, and their walking patterns will certainly be different, will certainly be considered abnormal, but you need to know with respect to what's considered normal for his or her age group. So this video will kind of introduce you to that world of kinematics, kinetics of mature walking. We know just from observations and research that joint angles are very similar early on, and as I mentioned earlier, there are 5 determinants by which we can assess the development of mature gait. So first year of walking, if you watch a child or a toddler learn how to crawl and learn how to stand and finally learn how to walk, their muscles and their skeletal system is learning how to adapt to their environment, specifically to 9.81 meters per second squared gravity, right? So they need to learn how to balance, and you can see why a child who's first learning how to walk, they tend to have higher cadence because they have shorter stride length. Their base of support tends to be wider than what we consider to be our own base of support because their muscles aren't strong enough. They're still learning how to balance through all of the torques that are induced by their body parts and gravity, of course, their center of gravity. So they're still learning how to assess their environment and respond to it. In fact, this is the reason why it's very important that if a child is first learning how to stand and walk, it's very important to let them learn that. That's why I don't recommend using those walkers or any of those type of walking assistive devices, because you're not teaching them how to, you're just teaching them how to ride, right? How to ride on these tools. So the best way for these children to walk is to learn the hard way. Be safe, of course, but let their bodies react to the environment that they're in. So this is a couple of views. This is sagittal view of the gait cycle, right? This is foot strike to foot strike, and this is the frontal view. And it's just look at what we have here in the sagittal view. You can see the stride length obviously is shorter. If you look at the foot and ankle, there is no heel strike per se, no heel to toe type of movement in the gait cycle itself. So it's more of a flat foot strike. It's more of an what we call an exaggerated dorsiflexion. Not a whole lot of knee flexion in early stance. In the swing phase, it's shorter. Don't have that same dorsiflexion that we see that's needed for the toe clearance. And then if you look at the frontal plane, you can see a wider base of support there. It's not spending a whole lot of time on each of the legs because they're not strong enough. And also, what do a lot of these children do in their arms? Right? They just keep them up. There's no arm swing. There's no reciprocal arm swing. So for the first year of walking, as I mentioned, there's no heel strike. It's more of a flat foot strike, an exaggerated dorsiflexion in both the stance phase as well as swing phase. In the front plane, or a transverse plane, you see more of an exaggerated external hip, externally rotated hip. Wider base of support, as I mentioned earlier, and there's a lack of reciprocal arm swing. So let's take a look at this video. This is a 1-year-old or just shy of 11 months. You can see the arms here. There, he looks like he's holding a rubber ducky, and I apologize for the quality of this video. This videos were taken from Children's Hospital San Diego many years ago. I think over 30 years now. So a lot of these videos, these children that you see here are full-fledged adults now. So anyway, you could see that the arm swing, lack of reciprocal arm swing there. So you could see the exaggerated, externally rotated hip as the child is walking. Wider base of support, as I mentioned earlier. And let's take a look at the sagittal view. Go ahead and fast forward this just a little bit here. Say hi to Daddy there. Cool. So again, flat foot strike, shorter stride length, not a whole lot of knee flexion, especially in the early stance. You don't see that loading response. The pelvis is anteriorly tilted. And of course, the arms are just up there trying to maintain balance, right? They're just learning how to walk early on. So this is a classic characteristics that we see in children's first learning how to walk in the first year. So let's take a look at the kinematics. I'm just going to highlight a couple joints here, the ankle and the knee. The ankle joint here, as I mentioned, you could see here more of a flat foot strike in the early stance, exaggerated dorsiflexion throughout, and in the swing phase, there's not a whole lot of dorsiflexion in order to clear the toes. So that's very important. In the knee, this is knee flexion extension. Early stance, there's roughly 10-15 degrees, which is a little bit of loading response knee flexion, what we call that controlled knee flexion, but not a whole lot, as I'll show you here. Even in the second year, that begins to be more pronounced. Okay, looking at the hip, as I mentioned earlier, the hip typically is in an externally rotated position throughout the gait cycle. A lot of it has to do with just simple anatomy. Their femurs haven't developed, actually their whole bones haven't developed yet. So the way that the joints and the joints are, well, one thing, the growth plates are not closed, not even near to being closed, and the bones are still being developing. So this is very important. I talk about how the musculoskeletal system is responding to the environment in which the child is walking, and not only muscles and ligaments are responding, but also the bones. So this is what we call Wolff's Law. The bones and joints and ligaments and muscles will all respond to the stresses imposed upon it. So if the body is experiencing what I call good stress, then the bones and the rest of the musculoskeletal system will develop accordingly. Okay, so that's first year. So second year, now let's take a look. Now there's more of a heel strike that's present, what we call the heel rocker. That's the passive plantar flexion that we see in mature walkers. There's increased time during the stance phase, or greater knee flexion in early stance. That's a controlled knee flexion I talked about. Increased dorsiflexion in swing. Now the child can clear their toe throughout the swing phase. Now we can see more of a reciprocal arm swing. So let's take a look at the video. So this is a child in the second year of walking. He doesn't look very happy, but like I said, these children are now adults. Now take a look. What are some of the things you see right off the bat? You can see arm swing, good. You could see, and just look at the feet, the foot and ankle. It seems like a normal heel strike, right? There's a more heel strike present. The knees, I know you can't see it from this view, but you could see there's a more pronounced knee flexion. One of the things that you want to take a look at too is the hips. How are the hips maintained, especially in the single leg stance? I'll talk about that in a sec here. Now, in the sagittal plane, side view, you can definitely see that heel strike right there, and that controlled plantar flexion as they go into the stance phase there, early stance. You get the knee flexion, controlled knee flexion, and during loading response as the opposite toe offs and goes into its own swing phase, the contralateral side does. This person's still crying. And you can see that reciprocal arm swing there. Cool. So let's take a look at the kinematics. Again, we'll just concentrate on the ankle and knee joints. Look at the ankle plantar dorsiflexion here. See that little dip there? That's dorsiflexion into plantar flexion. That's that heel rocker. That's that passive plantar flexion that normally occurs in mature walkers. We want to see that. That's that heel rocker. And then as the tibia goes over the ankle, you should see dorsiflexion. And then plantar flexion as the child toes off, and then dorsiflexion into the swing phase in order for that he or she to clear her toes. Now, look at the knee flexion extension. Now you get a more pronounced knee flexion in early stances, the loading response as the opposite leg or opposite toe comes off the ground, and now all of the individuals or the child's body weight is now on one leg, and so that shock absorption is that controlled knee flexion, right? That's the eccentric contraction of the quadriceps there. So now those muscles are getting stronger. And then into the single leg stance here, you can see as it goes into knee extension as the individual toes off, and then obviously into knee flexion during the swing phase for toe clearance. So now you could see that even in the second year, we're starting to see elements of mature gait, as we should. In the third year, now becomes as close to mature as possible. You can see the stride length is longer, cadence slows down, walking velocity as a combination of cadence and stride length increases. Remember what I mentioned earlier with regards to the hip? What do you notice particularly in the stance or base of support in the third year of walking? Correct. It's a lot more narrow, right? And the reason why it's narrow is because now they've got the strength and the muscular function to withstand gravity, to withstand and maintain dynamic stability, and a lot has to do with their hips in the frontal plane. So which muscles do you think is important in maintaining that frontal plane stability, especially in the single leg stance phase when the entire body is on one side? Correct. Hip abductors. Those hip abductors, the tensor fasciae lata and the gluteus medius, are important in maintaining the pelvis upright as well as the trunk when the entire body weight is on one side. And we see that more pronounced during running, and I'll talk about running in a separate video. In runners, we see a lot of issues with IT band, and the IT band, the two muscles that form the iliotibial band are TFL, tensor fasciae lata, and the gluteus medius, right? So hip abductors become stronger and a lot more pronounced in the third year walking. Hence, you will see a narrower base of support here. Knee flexion extension now is pretty close to what we consider mature, normal kinematic patterns in terms of controlled knee flexion into extension, and of course knee flexion during the swing phase. And you can see here that the reciprocal arm swing becomes a lot more vigorous, and they become more confident in the way they walk. Pretty cool stuff. So as I mentioned, summarize for the third year, narrower stance width, a more pronounced heel strike, and you get that heel rocker, that passive plantar flexion. Gait is a lot more confident, more vigorous, high cadence, as I mentioned earlier. A single limb support time is lower, still lower than that of an adult, but like I said, it's starting to get close to that mature pattern here in the third year. So as overall, it's looking like it is mature. So let's take a look at the video of how a 3-year-old looks now. Adult-like base of support. All the kinematics are very much adult-like. I don't like using adult-like. It's really mature-like, really. So if we can get this video to work, here we go. Again, I apologize. These are old videos from Children's Hospital San Diego that we digitized. So look at this. This is confident. She is walking. She's got a little bit of a catwalk going there. But look at the kinematics just from an observational standpoint here, from the frontal plane. Hips, right? Maintaining that hip abduction and make sure the pelvis and the trunk is upright, in line, and the center of gravity is kind of right down that middle there. The The base of support, as I mentioned here, the stance width is narrower as a person walks, and usually you see more reciprocal arm swing. I guess in this patient, she kind of had a little bit of swag in which she walked, but that's what you should be able to see. All right, let's see if we can fast forward this over to the sagittal plane. Look at that. I mean, that is as close to mature-like as it gets. Heel strike, normal heel strike at the ankle in terms of plantar flexion, the passive plantar flexion, and then into dorsiflexion during this early stance phase, and then early stance knee flexion. That's that controlled knee flexion that we want to see. And you can see a little bit of that reciprocal arm swing. So now you can see it's a more vigorous, confident gait pattern. So by the 4th year, it's what we consider 100% mature. And just take a look at this video. This is a 4-year-old, and she looks, you know, as confident of a walker as you would expect. So the dramatic changes, as I mentioned earlier, happens in the first 4 years of walking. And by the time the person is 7, we can consider that to be mature gait. In fact, if you work in a gait analysis lab and you have a child who's 8 or 9 years old, the normal kinematics and kinetics, the to which that patient will be compared will be the same. Will be mature gait. In fact, when I used to run the gait lab at Rady Children's Hospital in San Diego, those patients who were over the age of 7, the graphs were pretty much the same. That's what we would compare to. So it's mature. You can see the kinematics of both the, I'm just going to concentrate on the ankle and knee. Ankle plantar dorsiflexion is normal. See that heel rocker right there. You see the dorsiflexion in these as the tibia goes over the ankle in single leg stance, and then into toe off as the ankle plantar flexes, and then going into dorsiflexion in the swing phase for toe clearance. With the knee, you see that controlled knee flexion in early stance. That's roughly around 10% of the gait cycle. That's that controlled knee flexion, eccentric contraction of the quadriceps. And then leads into extension as the person toes off, and then of course flexion during the swing phase. So longer stride length, as I mentioned earlier, and faster mature velocity. So the 5 determinants of mature gait. Number 1, single limb stance duration. How long does that change, or that duration changes over time as a person or as a child goes from the 1st year walking to the 4th year walking. Velocity, cadence, and step length, that are obviously all related to each other because cadence and step length determines how fast they walk ultimately. So that all changes, that all increases as a person develops mature gait. Their pelvic width to step width ratio changes. So as the step width or stance width becomes narrower, what do you think the ratio becomes here if this is pelvic width to step width? Correct. It increases, right? Because the step width decreases, so the overall ratio increases. Yeah, so these are the 5 determinants by which we can assess and define mature gait. So let's just take a look at some of the literature regarding the development of mature gait. I was fortunate enough to learn under Dr. David Sutherland, who was the medical director and founder of the motion analysis lab at Rady Children's Hospital, and he literally wrote the book on the development of mature gait. And so one of the things that he found, and again, I'm not going to do his area of research and those of others like Dr. Perry and Dr. Gage over in Gillette, but I just kind of want to share some important aspects of that research. So single leg stance time is essentially the same thing as opposite swing time. So this is while the contralateral leg is swinging forward, the entire body weight is on one side. So that is an indicator, as I mentioned earlier, of single leg or unilateral balance, right? In order for the contralateral side to swing forward. So the important musculature that are important, the important muscles that are active during that time are what? The hip abductors. So that is an indicator of balance. And according to the research here, this is Dr. David Sutherland's one of his many articles on this subject here. This is published in 1997. Look at the single stance time here as it goes from the first few years of walking up until 7 years. Notice how the dramatic changes is the increase in time occurs in the first 4 years of walking. And in fact, from age 4 to age 7, there's not a statistical significant difference in stance time between those age groups. So again, most of that changes occur in that first 4 years here, as you would expect. Walking velocity, as I mentioned, because of the changes or increases in stride length, as well as the decrease in cadence, walking velocity overall increases the first 4 years, but then kind of just stabilizes, or I shouldn't say kind of, it does stabilize after the age of 4, right there. Same with, as I mentioned, stride length. You could see here that there is a direct correlation between stride length and walking velocity for obvious reasons.